Well, today we're going to discuss how to correct the hip thrust pattern. This is what a lot of people have been asking about, and Danny's going to have a little discussion here about what we actually do, why we don't want that posterior pelvic tilt, and why we want a good neutral position in the spine.
So as you can see, when we do perform posterior pelvic tilt, it causes the lumbar spine to flex. Now this is a dangerous position. The discs do not like that. As you can see, if we are flexing the spine forward, the disc fluid can migrate posteriorly, so backwards. This can press on a nerve and cause lower back pain. So from a spinal mechanic point of view, it's not ideal to have posterior pelvic tilt in a hip thrust.
Now, this is super important because it's not just about the loading down on the body, but when you're lying across, the muscles such as the psoas here, which attaches to your spine, that also has a pulling down effect. So the loading is also strongly through the muscles, not just from top to bottom. Muscles always have a cost. So when muscles contract, they cause loading and shear forces. These are the things that can aggravate the disc. What we do want to see is we want to see a hip hinge that works off a perfect hip movement. We want to see the rotation coming around the hip. A nice hip rotation and a beautifully neutral spine. Let's have a look at that.
Well, here's our first correction movement to teach you how to do a correct hip hinge that you can transfer to a hip thrust. Placing the band across the pelvis, not the lower back, across the pelvis. So that drives the hip backwards. And as you can see, Danny's going to basically parallel the spine. Now Danny's going to demonstrate how, as Julie goes forward, the spine is staying in a beautiful neutral position. Julie's bringing her arms forward, and as she comes to the top, she just brings her chin to her chest. They bring her chin to her chest, just engages the abs into an isometric contraction. So that's all it is. It's a brace that occurs. As Danny shows there, beautifully mirroring Julie's perfect neutral spine. This is a lovely hip hinge. There's no spinal flexion or extension being created, just due to keeping the head up on the top and then the bottom. Now, look at Julie as she creates the pelvic thrust with the posterior pelvic tilt. You can see that the posterior pelvic tilt is occurring here. Basically, it's not a hip hinge. This is a pelvic thrust. And as Danny demonstrates on the model there, there's spinal movement occurring, creating the pelvic thrust. That's what we're trying to avoid. Now, Julie's then going to actually show us how the transfer goes to a hip hinge. See how the body moves as one straight line. This is safe for the spine. You can see there's no spinal movement. The movement is coming off the hip hinge. Now we're emphasizing the hinge here. So Julie's just emphasizing the hinge. You'll see after we do a few repetitions and we get into it, we'll then give the cue just to bring the chin towards the chest in a moment. But at the moment, see how the spine is being held. There's the chin to the chest, which creates the abdominal brace. So this prevents that spinal extension by bringing the chin to the chest, braces the abs, stops you extending. So we're stopping posterior pelvic tilt, we're stopping anterior pelvic tilt.